Welcome, everybody. This is one of our coronavirus updates for the state of Colorado. We are going to be moving to twice a week starting next week. There's just a lot of information, and this is a time when really Coloradans need to step up and do better than we're doing with regard to coronavirus. You can look at it as the glass is half full or the glass is half empty. On the glass is half full side, we are doing better than many other states. We have shown major shifts in behavior from the type of behavior that in January or February had an R0 of 3 and would rapidly overwhelm our healthcare system. The bad news is that we've had some slippage, and the rates are going up here. We had our second day with over 400 new cases. What we need are adjustments about how we're living. We need to be more responsible. We need to wear masks more. We need to avoid gatherings more. We're hopeful. There's really been 2 changes in that direction in the last week that we hope will bear fruit. We won't have the data for a week or 2 on that. One is, of course, that the scenario of bars and nightclubs just don't work in this pandemic environment, and we came to that realization sooner rather than later. But we won't see the impact of that, if any, on decreasing the growth rate for another week or 2. The second is we now have more than half the state, upwards of 60% of the state, that has a mask wearing requirement in their area, in their city, in their county. That is something that is important to have that local buy-in on. We don't know yet exactly what that means in terms of mask wearing. One of the reasons we're doing better than other states is we have better mask wearing. We estimate we're around 70%, but it ain't enough. We need to get 85, 90%. Masks are very effective, both in preventing somebody who is contagious from spreading it, but also in protecting yourself. I'll also be presenting economic data today. Greater mask wearing is worth trillions of dollars to the economy. A study by Goldman Sachs I'll be talking about. So if for some reason it's not enough to want to save your own life, if for some reason it's not enough to want to save the lives of members of your household or people you care about, mask wearing is also a business issue and an economic issue. And that's why we've seen businesses across the state leading the way and making sure that employees and customers are wearing masks and staying as safe as possible. So we've not yet found here in Colorado that sustainable way of living that we can make it through this pandemic. We're close. Again, the glass is half full. We're not far off the mark, but the glass is half empty. The R0 is now, the contagion factor is now above 1, meaning the incidence of the virus is growing in our state, and we need to make changes in the way we live, minor changes, meaning socialize with less people, be 6 feet apart more often, wear masks whenever you are around others. We need to be better at that. We need to be better at that if we want the economic recovery, we want schools to open successfully, we want to save lives, all of those things. While we have an upward trend, we do not have any capacity issues in our hospitals, but 11 of the last 14 days have seen the upward trend. And we know that we need to make a mid-course correction. So, with the baseball analogy here, we're in the 6th inning, and we're actually down by a run here to the virus. 6-5, the virus is beating us, but we got runners on the corners and no outs. So, we're not down 10-0 like they are in Texas or Arizona. We're down, and we just need to play ball here. Whether it's a sacrifice fly, whether it's a single, we got a couple outs to do it. We just got to get a bit better. It's a much better situation than states that had an environment for the virus where it was spreading exponentially, which was the way that we lived in Colorado in January, the way that we all look forward to living again, right? I don't think there's anybody among us who isn't looking forward to the day where we can throw out our masks and hug one another and go to large neighborhood parties or nightclubs or large churches. We all are looking forward to that day. We all know that now is not that day. But we do need to do better. The health and safety guidelines that businesses are operating under, that restaurants are operating under, that bars that are operating like restaurants are operating under, they're very important to follow those. The compliance with the science-based guidelines for how we can live our lives and be open is really important. It's not a contest to cheat and see what you can get away with. It's really a contest to see how well you can keep yourself safe by wearing a mask, staying 6 feet from others, only going out in large public groups when you absolutely need to, especially if you're in the at-risk group. And what we've seen in the other states and what we're also observing here, that some of the main ways the virus is being spread, bars, we close them down. We need to make sure that all of the bars that are open, that are functioning as restaurants, as well as all restaurants, are taking the safety guidelines very seriously, following them to the letter. Very, very important. Enforcement is very important. And then a lot of it is human behavior. We were on a call the other day, and I don't remember whether it was Dr. Birx or Admiral Giroir or one of the folks, but there's they said really much more of the spread of the virus depends on behavior than it does on what the government policies are. It's maybe 20% government policies, 80% behavior was the figure that they gave us. And on that behavior side, and this is particularly directed at people in their 20s, teens, maybe some in their 30s. This is the summer of no parties. This is not the summer to party. And I know young people like to party. They like to be with 80 of their friends. They often like to have alcohol or maybe even legal marijuana involved. There might even be some people that are under the drinking age that like to do that, and that's not what we're focused on now. We're focused on the public health side. Our young people in our state, and of course people of all ages, but particularly people in their teens, 20s, and 30s, you can still have safe fun. You can have 3 or 4 friends over and, have a drinking game. You can go out in our beautiful outdoors and go camping. You can go to the park with 4 friends. But the question of whether we're having these large parties without social distancing where it spreads really will determine the future of our state. And look, I have an 8-year-old and a 6-year-old. I didn't think I'd have to tell anybody not to go to parties for 10 years when I was the father of teenagers. But I feel like this is a message that we have to get through now. And the young people of Colorado need to understand that if we want things to be normal, if we want to continue to be able to go out and enjoy life and go to the parks and the zoo and have a job and keep restaurants open, we have to forego, and you have to forego, because I'm not going to those parties, but you have to forego parties this summer and perhaps into the fall. So have fun with your friends in smaller groups. Whether it's, whatever kind of fun you're having, I don't care. Whether it's legal or illegal fun. I mean, we're not even talking about that. I'm just talking about the health side. I mean, if you're 17 and you're drinking, you probably shouldn't be doing it anyway. But you know what? From the health side, here's what I'm telling you. I'm not telling you don't drink, other than the way I normally tell you not to drink if you're underage. What I'm telling you is 4 friends, not a party of 80 people. Right? It's really important that people get that message because, and there's a small enforcement role. I mean, we want our noise ordinances enforced. I mean, we want to make sure that people are stepping in. But it really makes a difference between the virus going from 1 person to 3 people or 1 person to 65 people. And that makes all the difference for our state. So treat our health regulations in restaurants and bars that are functioning, restaurants that are open, bars are open in much of our state. Treat it seriously, the social distancing seriously. Don't have large parties. And stay home when you can. Reduce your socializations a little bit. Wear masks more. And hopefully we can reverse this trend here before it gets so bad that larger changes in action are needed by people. So, as I said, down a run, 6th inning, runners on the corners, no outs. We have a good shot at this. The glass is half full. Glass is half empty. We are down by a run. We are losing right now in Colorado. We're not losing as bad as our country. We're not losing as bad as the hot spots in Arizona and Texas. And before I get to the rest of it, I also want to say that we are a country. America, United States of America, we had between 50 and 100,000 Texans and Arizonans enjoy our state over July 4th weekend. We have freedom of travel in our country. We are able to go and come as we please between state lines. And no matter what we do here in Colorado, it's hard to be in a totally different place than the rest of the national trend. I mean, you'll see all the states move in a band. I mean, there's different hotspots at different times, but you're not going to see two states that are next to each other, you know, one go rapidly up and the other go rapidly down. It just isn't going to happen in our country. We are a nation. We, like other nations that have successfully handled this, New Zealand, Taiwan, we don't have the ability to lock down our borders that they enjoy. And so that being said, here's what's important. With so many people from viral hotspots in our state, it's important that every Coloradan, when you're around others, if you work in retail, if you work in a restaurant, treat every customer like they are contagious with coronavirus. Because whether they're from Aurora or Denver or Houston or Dallas or Miami or Phoenix, they may very well be contagious and they may not know it at that point, or they could be mildly symptomatic. So in all of our interactions with others, we should act as if they are contagious. And while the virus is wildly contagious, it's not so contagious that if you take the right precautions, you can be safe. We have people that work through the entire time in grocery stores, encountering members of the public. If you are wearing a mask, and hopefully they are wearing a mask, and you are 6 feet apart and it's a brief transaction, it is a very, very small chance of transmission of the virus. And you know, you might have hundreds of people go through, and of the hundreds, 2 or 3 might be contagious. But as long as you're taking those precautions, and that applies to all of us in our own lives too, just walking down the street, shopping, going to restaurants, as long as you're doing it in a smart way, you are significantly reducing the likelihood of the transmission of the virus. Wearing a mask, staying 6 feet from others where possible, of course, washing your hands whenever you can as well, or using hand sanitizer. As I've been saying from the start, we're going to be monitoring very closely, adjusting our strategy based on the trajectory of the spread. Now more than half the state under mask wearing requirements, and bars closed in probably 70% of our state. Let's hope that that's enough, but that's just that 20, all that's in the bucket of that 20% that the government does. This is 80% you. It's 80% you. So the summer without parties, and have fun with a small group of people, 3-4 people. Have fun. Don't put your own life and the lives of your friends in jeopardy. And if you don't care about the lives of yourself and friends, please don't cost the economy $5 trillion and jobs, even your own job. So, you know, individuals wearing masks, keeping distance, staying safe at home where you can, safe outdoors, continuing to advise people over 65 to take extraordinary measures to protect yourself. We do have community transmission in Colorado, and of course, practicing proper hygiene. My 75-year-old parents continue to stay home, and I support them in that decision. And I know that there are many other people in their 70s and 80s that are choosing to do that. And that's a smart decision because we want them there for many, many years and decades to come. The state is stepping up, working on PPE, testing supplies, of course, the economic support for our small businesses. But remember, our economic recovery is only as good as we are in containing the virus. You want to see economic devastation, look at what follows in the wake of the virus in Arizona and Texas. They are seeing additional economic devastation. They'd have to take step backs. Arizona is closed, you know, bowling alleys, movie theaters. Local governments are stepping up, finding the best strategy to increase mask wearing in their area, whether it's fines, whether it's publicity campaigns, whatever they're doing, we support. Also being proactive in repurposing space for more social distancing. Many cities have been in the forefront of getting folks out of the indoors into the outdoors. You know, the trend in the data of this virus on the scientific tide, 2 things. Masks are more effective than anybody initially thought 3-4 months ago, number 1. Number 2 is the outdoors is much better than the indoors. and a lot more data bearing that out. So Colorado small businesses are performing slightly better than the national average, partially because we've been more successful in containing the virus thus far. We're only 1 run down. The country as a whole is 3 runs down. Texas and Arizona are 10 runs down. Colorado small businesses are doing better in a number of different ways. We have a lower unemployment rate. It's not an acceptable unemployment rate, but we are 3 points below the national average in unemployment, and I'm very proud of Coloradans for wearing masks and staying in when they can and telecommuting and doing everything we can to keep our economy as strong as possible. But we need to continue the good work and continue to maintain our status as a positive outlier among our neighbors and in the country. Look, we need a coordinated national response to the coronavirus that we currently lack. But that's not something I, as your governor, can deliver. We have to live with the president and the administration we have, rather than the administration that we may want. So we want to do the best we can to continue to keep Colorado a positive outlier. Positive outlier in the health perspective, positive outlier economically. And we rely on your decisions that you make every day in your lives to be able to do that, along with the partnership that we talked about on how we can help. Now, we have some exciting new information today, and something that people can play around with on their computers at home. It's a modeling discussion. Now, who would have thought they wanted to talk about a pandemic modeling discussion, 6 months ago, a year ago, right? Now it's something you're all interested in, and I'm interested in. You all heard from Dr. Samet a number of times, the head of the Colorado School of Public Health. I call him Colorado's Dr. Fauci. We now have a public-facing website that he's going to tell you about, coloradocoronavirus.com, where you can actually plug in the parameters to say what percentage of people wear masks, what percentage of people how much are people social distancing. If there's different age groups, like what happens if the 20-somethings still party, but the 60-year-old pluses all stay at home. You can actually create all these scenarios yourself on coloradocoronavirus.com. It's been months of work. It's the same model that's been informing state decisions, but they had to run through the models and the parameters, and some have been presented to you. Now you can do it from the safe privacy of your own home without having to go out, and you can stay safe at home, and you can look at the same modeling with different parameters that the state is able to enjoy. Many people contributed to this work. I want to thank Max McGrath, a Boulder undergraduate who did the program, Katie Colburn, Beth Carlton, Andrea Buchwald, and of course the School of Medicine in UC Denver and Boulder and CSU. An interactive model that is so exciting, and I'm so proud to turn it over to something that will be a lot of fun for everybody out there, but also might inform your behavior and save lives, which I know drives everybody on the public health side. We really hope, and I know Dr. Samet hopes and the whole team hopes, that you really take this model to heart, input different things, play around with it, learn from it as we have, and I'm so proud to turn it over to Dr. Samet.
Okay, thank you so much, Governor. And as you said, this model that we're presenting to this application is the work of a very large team that's put a lot of effort into this over the last 2 months. The goal is to put into the hands of Coloradans the tools that we use to project where the epidemic may go, and to allow people to look and see how what they do can affect the course of the epidemic. So in this tool, which is going to be available today, you can vary, for example, how much social distancing there will be, how that might change over time, and also how carefully and how much people over 65 are distancing themselves. The app model includes the opportunity to change the proportions of Coloradans who are using masks and to see how that makes a difference, and also to look at contact tracing, which is ramping up now, a very important public health tool, to look at how well we do this makes a difference in terms of the number of people traced and how quickly we trace them. So I'm going to show you a few scenarios, and one is right in front of us now. This looks at hospitalization and the need for critical care beds. Blue, total hospitalizations, and then this sort of yellow-orange that looks at the number of ICU beds needed. There's a dashed line going right across the top that shows what our ICU capacity is to take care of people with COVID-19 who may need critical care. So embedded in this app are all the statistical equations, all the mathematics that we use to project the course. And now you're able to change this. In this particular scenario in front of you, we're showing what happens if we stayed at a pretty high level of social distancing, all of us, above 65%. This would sort of take us back to somewhere in June, around that level of distancing. And you can see we're safely below the dotted line. Now let's change the scenario, and we're going to move to 50% social distancing starting in August, and keep everything else constant. And what you can see is now that yellow-orange is above the dotted line. In other words, we're at a point we don't want to be at, a point we're trying very hard to avoid, which is where our need for ICU beds exceeds our capacity. And you can see the peak. You can see that this comes later in the year. It takes time to build up to this, and we have time to take steps to make a difference so we can avoid this kind of peak. So this is just two examples of what the model can do. Now, here we have 50% mask wearing.
So, if this assumes 50% mask wearing, how would that change if 100% of people wore masks in Colorado? Because we know that Colorado is the smartest state in the nation, and after today, and we tell people how important mask wearing is, it'll be 100%. So what happens then?
Well, great. I do hope I see 100% mask wearing after today, but this is exactly the kind of question that we've created the website so that people can answer for themselves. They may be going out to stores or wherever and seeing people without masks and asking the question, well, what if instead of half of us wearing masks or less or more, it went to 100%, which of course would be the goal. So this is the kind of question we are able to look at with the app. And that is up now for you to see. So you'll remember before that yellow was too far above the dotted ICU capacity line. And now you can see that by going from 50% of us wearing masks to all Coloradans wearing masks, we have brought the number of cases into a point where we have the capacity to manage this surge. You can see there's a surge compared to what happened before. But with masks, one of our tools, we have to use all of them. They're all modeled here. We are able to keep the epidemic where we need it to be.
Thank you, Dr. Samet. These are all hypotheticals, of course, but this will allow you at coloradocoronavirus.com to put in your hypotheticals. I mean, you can go to the grocery store, or you can go to your neighborhood and say, oh, it looks to me like 75% of people are wearing masks. You plug that in. Look at the social distancing. This tool is available now at coloradocoronavirusmodel.com for the public. And, this is, a challenge for all of us. This gives you the same information that we have. You can plug in whatever you want. But what those variables are depend on your behavior. They depend on whether you're wearing masks. They depend on you and us and all of us doing a little better than we have been doing. We need to tweak our lives, not the rapid, not the enormous change from our lives in January and February. We need to go to our lives in kind of early to mid-June, and we need to keep that up. This kind of, we can't get lazy here. We're in the marathon. That's the other metaphor we use, It's not the 23-mile mark as much as we wish it was. Maybe we're at the 12-mile mark of the marathon. And I know it feels like we've been sprinting. That first couple miles was definitely a sprint. But this pace that we're on, we have to pick it up and sustain it for the months to come. This modeling will show you intellectually why we need to do that. Why we need to do that is not political, it's not ideological, it's based on science. You can see the same science that we see. You can make the informed decisions in your lives to do a little better than we have been, getting back to kind of where we were in early June. A little bit more social distancing, a bit more mask wearing, and I think that we'll be able to successfully reverse this trend and keep Colorado a positive outlier, but that is not a foregone conclusion. It really depends on your actions in the coming weeks. As I said, mask wearing is not just a public health issue, it's an economic issue. So for some reason you don't, again, care about saving lives, maybe you care about money. Goldman Sachs came out with a new study that showed that universal mask wearing, 100%, would save $1 trillion, restore $1 trillion of economic activity. So if you want local restaurants and stores to be open, wear a mask. If you want to reduce the unemployment rate, protect jobs, maybe even your own job, wear a mask. If you want your stock portfolio to rebound, wear a mask. If you want professional sports coming back, wear a mask. Look, if Mike Trout, the highest paid player in Major League Baseball, can run the bases and can wear a mask, you can put one on for 20 minutes when you're going to King Soopers. And I want to thank our professional sports teams have been great, doing a great job following protocols, showing us how to do it right. They are deeply committed to following safety protocols. And these are young men in their prime, in their 20s and 30s, and they're following the protocols. So I know that the rest of us can as well in mask wearing and social distancing. And you know what? If people who work in emergency and intensive care for decades wear masks every day around the clock when they care for our loved ones, the least that we can do for our healthcare workers is to wear a mask when we're around others in public, at the store, in a street where we walk by other people. It's so important. I want to congratulate community leaders across our state that have helped implement mask ordinances, outreach, where, as I said, over half the state now has mask ordinances. And I know it can be a hard issue in some cases. It can be a hard vote for a city council person or a commissioner. But you are doing the right thing for your community. Your local businesses are enthusiastic about you taking action to help keep them open and return to normal functions. And we have a mask rule here in state government. We all wear them in the office. And in fact, we expanded our masks. We care about our county offices the county government is a locally administered unit of state government. People who are coming in to do business in our county offices now have to wear masks too. We extended it to anybody coming into our county offices or state offices a week ago or so, because we want to protect our state and county workers. And I know that businesses want to protect their workers too, and that's why more and more businesses are implementing mask wearing requirements for their is in your hands. The bottom line is the key to greater economic and social activity is wearing a mask. Both the virus suppression and the economic recovery will be based on the decisions that each Coloradan makes to stay safe, stay 6 feet from others, wear a mask where possible, and wash their hands regularly. A few additional announcements before we get to questions for me or Dr. Samet. First, I want to announce there's still paycheck protection money available for small businesses that need aid. So if you have a small business, means anything under 500 people, but if you have 400, you probably already applied. But if you have 3 people or 1 person or 5 people, go apply. Talk to your bank. Look at choosecolorado.com. You can still get it. It's a great program. $129 billion left in forgivable loans. Thanks to the hard work of the team at the Office of Economic Development, so far Colorado businesses have gotten more than our fair share of PPP loans relative to population. We're very proud of that. So thanks to the bankers, to OEDIT, to our economic recovery and advisory team. Visit choosecolorado.com for more help. We also know how important telemedicine has been during this pandemic. I signed a bill earlier this week that codified the law to make sure we can enjoy the benefits of telemedicine even after this pandemic. But we're also excited that we'll be dispersing about $400,000 to important partners in their innovative efforts to make more telemedicine available. It's more convenient, it's safer, you don't have to go in, and it's lower cost. What's not to love? So $400,000 will be going to folks like Access Health in Southwest Colorado, Beverly Hop in Colorado Springs, Clinica in North Denver Metro, Colorado Coalition for the Homeless in Denver, Developmental Disabilities Resource Center in Lakewood, and Mental Health Center of Denver. So congratulations to the awardees. We're eager to learn more about these innovative efforts, about how we continue to meet Coloradans where they are. Finally, some good news. One of my first executive orders was to establish emergency health care for healthcare workers. I recently received a report that because of the executive order, we ensured child care for over 1,500 families in the healthcare sector, so they were able to go to work and take care of everybody else, over 2,000 children. And the Emergency Child Care Collaborative was a great example of what can happen when we come together during challenging times to help fellow Coloradans. I want to thank Gary Community Foundation, Mile High United Way, and so many others for that important work. So thank you, Dr. Samet. Thanks to all of our businesses and sports teams that are doing the right thing. And thank you to you for keeping us in this game, for having runners on first and third and being only one run down. If you were wildly off, we would be where Texas is and Arizona is. The virus is the virus. How well it succeeds in our state simply depends on how we live our lives. We're in this for the long haul. Let's do it. Just a couple questions from the general public posted from my Governor Jared Polis Facebook page before we get to the media questions. Alyssa Milano Richard says, wow, after reading some of the comments here, I'm glad I'm currently in France. U.S. had 62,000 confirmed cases yesterday. That's crazy. I don't understand why wearing a mask is still a discussion. I agree, Alyssa. Well put. Denise Montmutter said, enough with the propaganda posts. If you're going to mandate everyone wear a mask, just do it. Civil disobedience will soon become the norm if you do. This is not about politics or ideology. It's about science and health. Wearing a mask is the smartest and best thing that you can do, along with staying 6 feet apart from others. David Miller asks, so if masks work, then is it safe to open everything up again? Almost everything's open, right? We haven't yet figured out as a nation or even as a world how to have nightclubs and bars and those sort of freewheeling environments, but the rest of the economy is open. And masks help, right? They don't reduce transmission to zero, but they help get it under control so we can be on a downward trajectory rather than an upward trajectory. And finally, Daryl Willard says, I wear a mask and surgical gloves when I go to the doctor or go to pick up my meds. It's a requirement for using the senior ride. And that's a great idea. And I don't know which senior ride he uses, but I'm so happy that something like the senior ride that Daryl uses has a requirement around masks for people to utilize it because it helps keep them safe. If you're going to the pharmacy to get your prescription, going to the doctor, let's make sure you're safe on the way in and the way out. And I want to encourage more folks who serve people of all ages to take those additional steps, to go above and beyond. Our safety guidelines that we do based on public health, they're a floor, not a ceiling. The pharmacy I go to installed a fiberglass between the checkout and the customer. So that's an additional step. I've seen that in other businesses. It's great. We want you to go above and beyond. The stuff we're giving you, the floor, not the ceiling. Do better. Let's win. Let's come back. Let's show that Colorado can continue to be a positive outlier and help the rest of the nation catch up. Okay, let's take some questions.
Governor,
yes.
You said that caseload is growing. We need more mask wearing, and you praised local leaders who created mask mandates, and they're doing the right thing for their community. Why leave this to local leaders? Why leave this to local leaders? Why not follow the lead of a Texas Governor Abbott and enforce your own mask order?
Yeah, so the state has minimal capability of enforcing a mask order. We don't have cops on city streets. We have a few state troopers. They're generally on the highways monitoring traffic violations. For a mask ordinance to work, it has to have the local buy-in, meaning the municipal police that are under the command of a police chief and usually a mayor or city council, and in an unincorporated area, the county sheriff with the buy-in from the commissioners. So we want mask policies that work, mask policies that increase mask wearing. There are many parts of our state. As I said, we're now a majority under mask wearing ordinances. We don't know exactly what mask wearing ordinances will do. We hope that they lead to increased mask usage. We think they will. We encourage, but they need to be enforced if we're serious. The state does have ability to enforce some of the business level requirements we have. For instance, if restaurants are not following the mask wearing requirement, the waiters and the chefs have to wear masks, we have the ability to pull the license of the restaurant or suspend their liquor license. And that is being done. It will be done because we are very serious about these requirements. But when it comes to enforcing them on city streets and in stores, we rely on our local partners to be able to do that. And I'm thrilled that more than half of Colorado the people of Colorado are now under mask wearing requirements.
So are you essentially afraid that they wouldn't listen to you if some cities wouldn't listen?
Well, I'm for wearing masks, whatever you want to hear from me to wear a mask. If you're somehow waiting to wear a mask till the governor tells you to, I hope you've heard that I'm telling you to. And if I haven't been clear, I'm telling you to wear a mask. Wear a damn mask, right? If you're somebody who wants to do the opposite of what the governor says, You should wear a mask because the data shows that that's the best way to save $1 trillion for our economy, reduce unemployment, and protect your own life and the life of your loved ones. I am not going to get into the psychology of whether people want to flout the rule of law or obey the rule of law. What I want to get at is the maximum number of people wearing masks. Don't wait till there's a mask wearing ordinance in your area to wear one. Don't just wear one because you might get a $200 ticket if you don't. Wear one because you might save your life. You also might save your job. You might save your stock portfolio. You might keep your local businesses open. Lots of good reasons to wear a mask. What Governor Polis says is least among them, but if you really care and you want to know what I say wear a mask.
Hello, Governor. This is Vinny Deljudice of Bloomberg News in Denver. 2 questions regarding PPI. How is the state braced for another wave if we have one? Swabs, testing capacity, hospital supplies, ventilators. And a question on schools. How will they reopen in Colorado? Thank you, sir.
Yeah, so this is where our country has never gotten out of the first wave, right? The first wave had a peak in the Northeast. Now it has a peak in the Sun Belt. Colorado's been battling through this the whole time. We were able to stay just below some of the hot spots in the first peak. We hope that we can stay below the hot spots in the second peak if we're doing the right thing. But this is still with us. It is still very much a continual wave, and there's other areas of the country that it is likely to hit that it hasn't hit yet. We are doing better on the supply side. We have more PPE, we have more swabs, we have more tests than we did when this took not just us by surprise, but the entire nation by surprise when the first cases and the exponential growth were first experienced. So we're in a better position. Doesn't mean that we or any state is where we want to be. We continue to make extraordinary efforts to purchase both tests and PPE in the international supply chain domestically. We appreciate any efforts here in Colorado on the private side on our hospitals to increase their purchasing of equipment as well. So we're in a better place, but we always want to do better, and we'll be happy to give a numerical update on that at a future press availability. I expect that most schools will be back in a more or less normal fashion in the fall. Doesn't mean every school every day all the time. We have to just as react to site-based outbreaks in the private sector, which we do, and there's a number of them every day. If it's a restaurant, if it's a store, testing, sometimes a closure and cleaning, contact tracing. That approach will also need to be used for schools if there is, or dare I say when there are, because there likely will be if the virus is as prevalent as it is now, school-based outbreaks. Those students will likely need to convert to the online format for a week or two. Till the incubation period's expired and people can be tested and released to go back to work and the outbreak is contained. So we've developed this outbreak model. It's not perfect. It's better than it was 2 months ago, and it'll be better, even better than it is now when schools start in the fall.
Governor, back when you were debating whether or not to issue the stay-at-home order, you were worried about enforcement there. Ultimately, in a few-day period, decided to go to the stay-at-home order. What's different about the mask and that? And I also wanted to ask you, your GERC this morning was leaning toward recommending that you issue a statewide mask.
What was?
The GERC.
Oh, yeah.
And if they do recommend that you issue a statewide mask mandate, would you follow that?
Well, look, what I care about is how many people wear masks. So if a mask order helps you wear a mask, we could do a mask order. If it doesn't help you wear a mask, then just do whatever it takes to wear a mask. There's no ability the state has to enforce it. Coloradans did a great job staying at home, a fabulous job. Thank you. That's the only reason we were able to avoid being one of the hot spots ourselves and having to have a longer shutdown. We were able to open early, get back to a sustainable way of life. I feel sustainable. I mean, my daughter is in a summer camp. Not every week like she'd like to be, but she's done 2 small groups, reasonably safe. If we can continue to make these tweaks, and get ahead, school will be back. So whatever it takes to increase mask wearing, I'm for. I don't think there's too many people that are sitting around saying I'm not going to wear a mask till there's some piece of paper. But you know what? Fines in the municipal level, if they're enforced, can be effective, particularly on out-of-staters. If there's folks coming here from hot zones, as I said, 50 to 100,000 Texans and Arizonans in town over July 4th weekend, I think they should be cited and given tickets if they're violating mask ordinances in their area, because they have to learn that Colorado is serious about this. So, Jesse, I haven't ruled out anything. I want to do whatever course of action I think will lead to more mask wearing in our state.
Hospitalizations seem to have stabilized somewhat, but yet infections are going up. Are you concerned, Governor, that we're on the verge of another storm coming our way?
So we have seen an increase in hospitalizations as well. It lags behind the new cases by a week to two. The way that the virus presents is usually, I think the typical time from first symptom to hospitalization is 8 to 10 days. So you're going to see that on an ongoing basis, that when you have increasing cases, the hospital load will increase 8 to 10 days later. So we are seeing an uptick in hospitals following the uptick in cases. And I guarantee you, based on over 400 cases today and the uptick we're seeing the last couple of days, 8 to 10 days from now, you will see an even greater uptick in hospitalizations in Colorado. Telephone?
Mayor Polis, it's David Clue at Denver 7. The city of Greenwood Village just approved a resolution defying the state's new police accountability law by accepting all liability for their officers' misconduct. The state attorney general has already said the decision can't stand. Where do you come down on individual municipalities or counties picking and choosing what parts of that law they like and what parts they don't?
Well, the bipartisan police reform is the law of Colorado. So that's the law under which all of our police departments and sheriff's departments operate. It was designed to help restore trust between communities and law enforcement. And it's important for any community to have that trust. And we all function under the laws of Colorado, including the changes to civil liability, including the ban on chokeholds, the requirements around video cameras for those officers. All those are the law of Colorado, and I'm confident that communities across our state will continue to follow the law.
Last question.
Dr. Samet and Governor Polis, the public got used to seeing these model reports that your team had been working on. Now we've got this web app. Is this going to replace those model reports, or should we expect to see more of those? Maybe you can just talk a little bit about what the research team will continue to produce.
Sure, absolutely. So one point, the model itself will be updated on a weekly basis to reflect what we've learned about where we're going in Colorado. Second, I think we are likely to begin posting our own weekly updates of the model on our website at the Colorado School of Public Health. So essentially the public will have both. They'll have what the modeling team is putting out, the material that CDPHE and the governor receives, and then the public itself will have a continually updated tool that it can use.
And so everybody can plug in the information at coloradocoronavirus.com. What Dr. Samet and Dr. Herlihy and the team will continue to do is also try to figure out where Colorado actually is on these different indicators. So looking at a variety of data sources, where are we on social distancing? Where are we on mask wearing? We never know exactly, but we have to have working estimates to be able to see if we're moving the right way. I believe that making sure that there's not bars and nightclubs, now that I've told you in the dad voice not to party, teenagers and 20-year-olds. I know none of you are going to party this summer, so thank you. That will help save lives and get our economy going back to normal. And of course, also the fact that now more than half of our state is under mask wearing ordinances. All of those, I think, bode well. Cautiously optimistic with a runner on first and third and no outs that we can score at least one run to get tie and hopefully two. We'll take one more telephonic. Okay, one more from the room.
You've been using a baseball analogy a lot. There's talk of the Rockies possibly allowing crowds to come back, and then there's Vandermeer Speedway as well that had some crowds and there are questions being raised about that. What are your comments on places, large venues, welcoming crowds back and having crowds that are sometimes violating state orders?
Yeah, it's a little easier to figure out than nightclubs and bars. with regards to the Rockies, I think as a baseball fan, we want to just get the teams playing, see if they can and pull that off first. I mean, issues with players and umpires, and let's see if they can play, and then we're happy to have that conversation about how we can safely have fans. It's not so much about the seated part. That's quite simple with us, a few thousand people in a 60,000 person venue. It's easy to have distancing. It's more about how you get in and out, concessions and bathrooms, and it's not impossible to envision how that could work. But let's just see if we can have a baseball season. Then we can talk about what we can do to get some folks in there. But that is a easier problem to solve than bars and nightclubs, which at least inherently seem like a kind of activity that that spreads the virus. It's difficult to see how social distancing and mask wearing can be consistent with an environment where people have to talk very loudly in close proximity and are there specifically to meet people. We want people to have that opportunity as soon as they can, as long as it doesn't force the rest of the economy to close or businesses to lay more people off or cost a lot of lives. So as I said, we're going back to twice a week. We're going to do Tuesday next week and then a virtual one on Friday. We'll probably go back to 2 in person after that. This is a marathon. That's the other metaphor. Coloradans are athletic state. We have one of the lowest obesity rates, and we have a lot of runners that train up my way in Boulder, taking advantage of the low oxygen level to get their blood legally ready for competition at sea level when times are safe. But yeah, we're at the 12-mile point. So picking up the pace ain't easy. I don't run marathons. I can't even run a mile. But for my friends who do, we got to pick up the pace a bit here, knowing that there's 12 miles ahead, but we're just falling a little bit behind. I mean, not like, I know with that sprint we started out, that was tough. We're not talking about going back to that. We just got to pick up the pace a bit here, wear a mask more, stay home a little more, stay 6 feet apart from others, not have parties, be smart, be safe, save lives, save the economy. I know you can do it, Colorado. Thank you.